Hello, everyone, and welcome to this session of Psoriasis Awareness. I'm Dr. Anushka Amlani from Integrated Health and Wellbeing Council. This interaction with top dermatologists from the length and breadth of India is aimed to spread awareness for psoriasis. Today, on account of World Psoriasis Day, we will be talking to Dr. Sushil Tahiliani, consultant dermatologist at Dr. Tahiliani's Skin Clinic. Welcome, sir.
Thank you.
As we begin, I'd like to briefly set the context for this session. Psoriasis is a disease that affects 10 million people in India. It is a disease that is not just skin deep and not fully understood. With the launch of Live Life Limitless, an awareness campaign, we aim to make an impact to the awareness of psoriasis, right from the basic do's and don'ts to the advancements in therapies. Once again, I'd like to welcome Dr. Sushil Tahiliani to share his valuable insights with us today. So, as we move on, can you please help the audience understand what is psoriasis and how does it impact the patient's life?
Psoriasis is a multi-system disease. So mark my words, it's a multi-system disease which presents to dermatologists because the primary manifestations come on the skin, and it affects about 2% of world's population. And it's a condition that's due to our own immune system attacking our skin, and it's more likely to be seen in people who are genetically predisposed. So I have to say that if one of the parents has psoriasis, the risk of a kid picking up psoriasis would be about 25%, in contrast to risk in the general population, which is 2%. In people who are genetically predisposed, the immune system targets the skin and the other systems in response to trigger factors. The trigger factors could be change in the weather, the dryness of skin. It could be because of eating habits. It could be alcohol, tobacco. It could be injuries. It could be infections. It could be extreme mental stress. All these are some of the trigger factors which bring it back onto the skin. And then it is seen as well demarcated pinkish, scaly plaques, which classically start from the scalp but can affect the entire body. Luckily, in about 60 to 70% of people, it remains localized to small areas of body. So we call it mild to moderate psoriasis. But in about 20 to 30%, it can progress as it keeps happening. And one thing people have to understand about psoriasis, it's a chronic and potentially relapsing condition which can keep relapsing at variable intervals throughout a person's life. And as it keeps relapsing, it can spread and it can involve, but as I said, it's a multi-system disease. Untreated psoriasis can lead to involvement of the joints in form of psoriatic arthritis in about up to 30% of psoriasis patients. And what is not very well known is that the inflamed skin, the pink skin, generates certain substances called cytokines, which can go into system and can cause systemic inflammation. So one can see a risk of coronary artery disease in good 20% of people with psoriasis because of psoriasis.
That was very insightful, sir. So, could you elaborate on the impact on a patient's regular day to day life because of psoriasis?
Sometimes we take it very lightly, but I can tell you from my 4 decades experience that it can majorly impact a person's life. And we always keep looking at how much percent of area we have cleared, how much area of the skin we have cleared. We don't look at how much load on the patient's quality of life have we reduced, improved. Because a person with a lesion on the knee stopped playing tennis because he could not wear shorts. His friends would see it, the playing partners. When somebody has it on the palms, they stop shaking hands because the person opposite you will feel the roughness and they start saying namaste. So people stop socializing. They don't attend the events of the family and the friends. They're conscious that the person, others are looking at his or her skin. They sometimes they feel that when they go to a restaurant, though they are paying the same amount of money and they're giving the tips, they are not attended to as well as somebody with normal looking skin. Think of how it can impact. In certain professions, a visible lesion of psoriasis can make a person be rejected for jobs. So professionally, it can affect you. It can reduce productivity because when it becomes severe, sometimes number of times people have to take leave and sit at home. That affects the productivity and promotions in the at the place of work. And lastly, interpersonal relationship, even in the married life, can get majorly affected by psoriasis. So you can think of how it impacts a person's life in all spheres.
Yes, sir. So, having understood that, we have briefly discussed that the disease is chronic. What are some of the long-term complications that are involved in, like, during the treatment of psoriasis as well?
So when we don't treat, as I told you, and if it becomes more severe, in up to 30% of people, psoriasis can lead to psoriatic arthritis. We can have a coronary artery disease. You can have people who are anxious, they go into depression. A study done in North America showed that up to 2% of people with uncontrolled psoriasis have at times in their life suicidal ideations. And psoriasis can make a person be a recluse, eat, drink, put on weight, smoke, and that is how it can make a person suffer from metabolic syndrome also. And in the woman, psoriasis can lead to high risk of polycystic ovarian syndrome if you don't treat.
Those were some really insightful facts, sir. Moving on, sir, what are the treatment options available for psoriasis in terms of topical and conventional? And what are the current new treatment options that patients have?
So when we look at a small lesion of psoriasis, we tend to treat with the local application. And those local could be as simple as moisturizers and emollients, but the active drugs could be topical corticosteroid creams or lotions or ointments, and which can be used judiciously in a safe way. Then, in good old times, we used to use titranol and tar, and nowadays we have products like topical calcineurin inhibitors. We have vitamin A analogs called tazarotene topically, and we have vitamin D analogs, calcipotriol. These are some of the topical agents, and now there are newer topical agents not yet available in India in a big way, and those are called topical JAK inhibitors and various other products like tapinarof and topical PD4 inhibitors. These are some of the new creams and ointments on the horizon. But as I said, psoriasis is a systemic disease, so when it affects more than 3 to 4% of body surface area, we may not be doing a good job by just putting creams on the skin. People in such more extensive cases will need internal medicines. And conventionally, we used for more than 4 decades molecules like methotrexate, cyclosporin, and acitretin. They had their pluses and minuses, and you could not use it forever. So then came small molecules like PD4 inhibitors like apremilast, and we have some JAK inhibitors like deucravacitinib. These are small molecules which are available orally, but the revolution in the treatment of psoriasis was brought about in the year 1998 when biologics were introduced. Biologics are injectable medicines which can be either injected in the skin or in the veins intravenously, and these block some of the steps in the inflammation cascade which leads to psoriasis being such a bad disease. Therefore, they block the inflammation and they reverse the disease and clear the skin. The advantage of biologics was that they did not have any organ-specific side effects. Like, for example, if I use methotrexate, I had to not go beyond a certain point because I'll be worried about effect on the bone marrow, the hemoglobin white cells count going down. I have anxiety about liver functions getting deranged. When I use cyclosporin, I'm concerned about the effect on the kidneys, the blood pressure, cholesterol, and triglycerides getting affected. When I use acetretin, which is vitamin A analog, I can't use it in a childbearing age group woman because of the effect it can have on the fetus, teratogenic effect. So these are relatively safe biologics. They don't have any organ-specific side effects. And once you've screened a person for suitability and ruled out the contraindications, you can safely give it for a longer time. The only monitoring you need while the patient's on treatment is maybe a few tests once in a year. And some of my patients have already been on such molecules for a decade and longer. So these second advantage of biologics is in a good number of people, we can clear the skin completely. Before the advent of biologics, when we brought about 75% improvement in the skin, we used to call it PASI 75. We were satisfied. It was supposed to be a good result. But if you have PASI 75, two-thirds of such people still have an impaired quality of life. When you bring it to PASI 90 to 100, which is 90 to 100% clearance, you can bring about so much more improvement in patient's quality of life, which was not possible with the previous molecules. It can also affect, improve the internal system involvement. It corrects the, reverses and arrests further progression of arthritis. It can improve the heart functions. So in short, you are treating the psoriatic disease, not just the skin.
Thank you so much, sir, to help us understand how biologics helps live life limitless. To a lot of patients who are going through the treatment of psoriasis. Moving on, sir, what is the importance of regular doctor consultations and therapy adherence to live life limitless?
So we all have to remember psoriasis may not always be psoriasis, number one. Everything on the skin is not psoriasis because looks can be deceptive. Secondly, there is so much more about psoriasis that social media cannot teach you, which a doctor who specializes in this subject would hopefully know better about it. And therefore, you are in a position to control your disease and enjoy life free of psoriasis under medical supervision in a very logical way. And if you don't take consultations, if you resort to self-medication, and there are alternative sciences where patients come and tell me the disease increased, but the doctor told the patient that first we will bring it out. I explained to them that when you bring it out and cover the entire body with psoriasis, you're causing so much more inflammation, so much more of those cytokines are going to system and damaging your system and causing systemic inflammation. That's not a very correct concept. So regular treatment with a qualified doctor, regular consultation with a qualified doctor, be in touch with that person who will hopefully do a good job for you. So that's what we are trained to do.
Definitely, sir. Thank you for your insight, sir. Before we conclude, can you please conclude with your remark for the World Psoriasis Day?
So I would say psoriasis is a big challenge, but we have many answers to this challenge. And once we have a proper approach and we just don't see a doctor and take treatment, you also improve your lifestyle because when you have a regular lifestyle with smart diet and don't put on weight and do some exercise, that itself will bring your psoriasis intensity down and doctors will help you further. So it's possible to manage psoriasis when I shouldn't be mentioning, but when people like Kim Kardashian can be moving around in bikinis, having managed their psoriasis well, when people like Phil Mickelson with psoriasis and psoriatic arthritis can manage their psoriasis and be very good at golf, there's no reason you and me cannot manage it well.
Definitely, sir. Thank you for your valuable insights today, sir. It was great having you on this day. Thank you.
It's a pleasure. Thank you.